Sex can be a joyful part of life, but it comes with the responsibility of protecting yourself and your partner from sexually transmitted infections and unplanned pregnancies. Safe sex practices are essential for keeping yourself healthy while enjoying intimacy. Here are actionable and practical safe sex practices to protect yourself from sexually transmitted infections and unplanned pregnancies. Number 10. Open and honest communication. Good communication is the cornerstone of safe sex. This means having open discussions with your partner about sexual history, sexually transmitted infections testing, and contraception before becoming sexually active. These conversations might feel uncomfortable, but they are crucial for establishing trust and ensuring both partners are informed and prepared. Discussing sexually transmitted infections, previous partners, and contraception options can build trust and make both partners feel more comfortable. It also helps to clarify each other's boundaries and preferences. Being upfront about your expectations and agreeing on safe sex practices ensures that you and your partner are on the same page and reduces the risk of miscommunication. Ask questions like, "When was your last sexually transmitted infections test?" Or "What kind of protection do you prefer?" These questions help establish boundaries and show that you care about each other's health and well-being. This not only protects you, but also fosters intimacy and trust. Number 9. Regular sexually transmitted infections testing. Getting tested for sexually transmitted infections regularly is one of the most important things you can do for your sexual health. Many sexually transmitted infections, such as chlamydia and gonorrhea, often do not show symptoms. As a result, you or your partner could have sexually transmitted infections without realizing it. Regular testing ensures that you know your sexually transmitted infection status and that of your partner, allowing both of you to take appropriate precautions. If one of you tests positive for sexually transmitted infections, treatment is available for most infections, and early detection helps prevent further spread. It's recommended that sexually active people, especially those with multiple partners, get tested regularly. Visit your healthcare provider or a sexual health clinic for regular sexually transmitted infections testing. Some clinics offer free or low-cost testing services, and many tests are quick and easy. Knowing your status ensures that you and your partner can make informed decisions about your sexual health. Number 8. Always use condoms. Condoms are one of the most reliable methods of preventing both sexually transmitted infections and unplanned pregnancies. When used correctly, condoms act as a barrier to prevent the transmission of sexual fluids and infections. Latex condoms are the most common, but alternatives like polyurethane or polyisoprene are available for those with latex allergies. Condoms should be used every time you have vaginal, anal, or oral sex. Don't forget that sexually transmitted infections can be spread through oral sex as well, so using condoms for all types of sexual activity is essential. Condoms are also relatively inexpensive and widely available, making them an accessible option for most people. Make sure to use a new condom for every sexual encounter. Condoms should be put on before any genital contact occurs, and you should always check the expiration date. To enhance safety and comfort, consider using water-based or silicone-based lubricants with condoms. Number 7. Consider other contraceptive methods. While condoms are effective at preventing sexually transmitted infections, they may not be enough to fully protect against unplanned pregnancies. Adding another form of contraception, such as birth control pills, intrauterine devices, or contraceptive implants, can provide extra protection. These methods work by preventing ovulation or fertilization, offering additional security against pregnancy. It's important to note that hormonal contraceptives, such as birth control pills, do not protect against sexually transmitted infections. Therefore, combining hormonal methods with condoms is the best approach to ensuring protection against both sexually transmitted infections and pregnancy. Consult with your healthcare provider to determine the best contraceptive method for you. There are a variety of options available, and finding the right one depends on factors like your health, lifestyle, and preferences. Number 6. Get vaccinated. Vaccines are an excellent way to protect yourself from certain sexually transmitted infection. The HPV vaccine, for example, can prevent many strains of the human papillomavirus, which is responsible for genital warts and some cancers. Similarly, the hepatitis B vaccine protects against the hepatitis B virus, which can be transmitted sexually. Vaccination is an essential preventive measure, especially for those who are sexually active. While condoms protect against most sexually transmitted infections, vaccines can provide additional protection against infections that are not always covered by barrier methods. Make an appointment with your healthcare provider to discuss vaccination options. Many vaccines are administered in a series of shots, so starting early ensures you are fully protected before becoming sexually active. Number 5. Limit your number of sexual partners. Having multiple sexual partners increases your risk of contracting sexually transmitted infection. While this doesn't mean you need to abstain from new experiences or relationships, it's essential to be mindful of your sexual health and that of your partners. Limiting your number of sexual partners reduces the chance of exposure to infections. Monogamous relationships, where both partners are exclusively with each other and have been tested for sexually transmitted infection, provide an added layer of safety. This does not mean that open or polyamorous relationships are inherently unsafe, but regular testing and communication become even more critical in these dynamics. If you have multiple partners, consider getting tested more frequently and ensuring that everyone involved is informed and using protection. This proactive approach reduces the risk for everyone. Number 4. Use protection with sex toys. If you're using sex toys, it's important to remember that they can transmit sexually transmitted infection if not properly cleaned and maintained. Each time after use, clean your toys with warm water and mild soap or a specialized toy cleaner. Using protection like condoms on toys, especially when sharing them with a partner, is crucial for reducing the risk of infections such as bacterial vaginosis, herpes, and even HIV. Condoms on toys should be changed between partners to prevent cross-contamination. Additionally, ensure that different toys used for anal play are not transferred to vaginal or oral use without proper cleaning, as this can transfer harmful bacteria. After enjoying your toys, take the time to clean them thoroughly with soap and water. If you're planning to share, always use a fresh condom for each partner and clean the toy between uses to keep things fun and safe. This small step can prevent the spread of infections and keep everyone involved healthy. Number 3. Avoid alcohol and drugs during sex. Alcohol and drugs can severely impair your judgment, leading to risky sexual behaviors such as forgetting to use condoms, not discussing sexually transmitted infection status, or failing to use birth control. These substances can lower inhibitions, which may result in unintended and unsafe sexual encounters. When you're under the influence, you might be less likely to follow safe sex practices, increasing the risk of contracting sexually transmitted infection or facing unplanned pregnancies. Avoiding alcohol and drugs during sexual activity helps ensure that you remain in control of your decisions, allowing for thoughtful choices that prioritize your health and your partner's well-being. Before engaging in any sexual activity, it's crucial to be sober and fully aware of your actions. Staying clear-headed allows you to have meaningful discussions about contraception, sexually transmitted infection prevention, and boundaries, ensuring a safer and more enjoyable experience for both you and your partner. Number 2. Emergency contraception is available. Sometimes accidents happen. If a condom breaks or you forget to use contraception, emergency contraception can help prevent pregnancy. The morning after pill is most effective when taken within 72 hours of unprotected sex. It's not a regular method of birth control, but a good backup option in case of emergencies. Keep emergency contraception on hand if you're sexually active. While it's not a replacement for regular contraception, it provides a safety net if something goes wrong. It's available over the counter at most pharmacies. Number 1. Know your body and be aware of changes. Understanding your body and being aware of any changes in your sexual health is essential. Symptoms of sexually transmitted infection can vary, from sores and rashes to unusual discharge. If you notice anything unusual, it's important to see a healthcare provider immediately. Early detection of sexually transmitted infection can prevent complications and ensure you receive proper treatment. Being proactive about your sexual health and recognizing when something is off can protect both you and your partner. Perform regular self-checks and pay attention to any unusual symptoms, such as itching, discomfort, or changes in discharge. If you notice something abnormal, don't hesitate to seek medical advice. Thanks for sticking with us to learn these essential safe sex tips. Remember, staying informed is the first step to protecting yourself and your partner. If you found this helpful, don't forget to like this video, subscribe to our channel, and hit the bell icon so you never miss an update on important health topics. Stay safe and stay informed.